For breastfeeding for men, there isn't any evidence that shows that when a man breastfeeds.
So where did that come from? Because a lot of men believe that when they are being breastfed. So, for instance, if somebody, like, you don't want to get any of these, you don't want to go through this process, you don't want to get cancer, what are some of the things we have to do to, not get into that side of things?
Let me speak specifically to breast cancer.
Breast cancer, yes.
Yeah, so the question would then be, what are the risk factors that will help you to modify them? The number one risk factor for being breast cancer, unfortunately, is just being a woman, because 99% of breast cancers are in women.
Just being a woman.
So that, unfortunately, there's not much that you can do about. So what are the ones that you can modify? We also know that alcohol intake, smoking, smoke or tobacco contains certain carcinogens or certain chemicals that can change the cells of our body and predispose the cells to grow into cancer. Remember that cancer developed from normal body cells. So the normal breast cells that were once good to you, one day they begin to grow out of control and they stop taking instructions from the body's own mechanisms that ask them to stop growing. And then they take their own lineage or they take their own pathway and start multiplying. And then you have a tumor developing. So smoking and alcohol are one of the things to avoid.
Doc, when you say smoking, what exactly are we smoking?
Tobacco.
Tobacco?
Yes.
How about shisha?
So all of those kinds of smoking contains...
All those things.
Not all of them have been proven categorically, but for tobacco specifically, I can speak to that.
Okay.
That reducing the consumption of it reduces the chances of getting breast cancer. And then we also know that people who have a higher body weight tend to have a higher risk of developing breast cancer compared to people who have a normal body mass index. That's another thing. And then we often advise the women to breastfeed when they give birth, because breastfeeding your baby for a longer period of time reduces the chances of getting breast cancer.
They said breastfeeding for babies, not men.
So breastfeeding for babies, not men.
Yes.
For breastfeeding for men, there isn't any evidence that shows that when a man breastfeeds.
So where did that come from? Because a lot of men believe that when they are being breastfed, then that means you don't get cancer. Where did that whole story come from?
Let's explain this. You see, the reason why breastfeeding a baby reduces the risk of getting breast cancer is because when a woman is breastfeeding, during the time, most of the time, you often realize that when the woman is breastfeeding exclusively, her menses usually does not return until she stops, most of the time. That period of you not having your menses reduces the exposure of your breast to estrogen, because the estrogen is coming from the ovaries. And every time your menstrual cycle is running, there's frequent supplies of estrogen in the blood, which your breast tissues are exposed to it. But I don't know of any man that can breastfeed to the extent of reducing or preventing menstrual, a woman from ovulating. So you see the differences.
Okay.